It's taken some time, but the World Health Organization has now declared the novel coronavirus a global health emergency, confirming it has escalated into an unprecedented outbreak. More than 170 people are confirmed to have died from the outbreak in China, and there are more than 8,000 cases there that have been confirmed. The virus also spreading to at least 18 countries. The Director General admits it poses too great a risk beyond China.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
The sick just keep on coming. There's no let-up at the epicentre of this outbreak. Every corner's crammed with patients, and it's moved at a frightening pace in just a matter of weeks. The virus, which originated in Wuhan, has spread to every region of China. The infections have now utterly eclipsed the number of SARS cases during a year-long outbreak. And it's still spreading across a range of countries. The doctors at ground zero and those dealing with victims around the world are coping with an international crisis, crying out for international action. As governments scrambled to get their nationals out of the epicentre, this was a plane carrying Americans from Wuhan. It became apparent different countries had different strategies to deal with those returning home. The Americans will not have an enforced quarantine period, whilst others will. A plane organised by the EU set off from Portugal to pick up a range of European nationalities. It's unclear what will happen to those they pick up, but the crew saw the flight as a mercy mission. They face a fortnight in quarantine on return. The worldwide alarm meant an Italian cruise ship was kept in dock at a port north of Rome. Its 6,000 passengers all locked down after a Chinese couple on board reported feverish symptoms. They finally tested negative for coronavirus. In Hong Kong, they're on the front line of this health crisis. The medics are urgently trying to contain it. But they have more border crossings with mainland China than anywhere else, and they fear a spike in cases is just around the corner.
A second coronavirus case has been confirmed in Queensland, bringing the national total to 9. Several people are in isolation as well at Gold Coast University Hospital. Let's go live to Julia Bradley there. Julia, what do we know about this second case?
Well, the 42-year-old Chinese woman was travelling with the 45-year-old man who was Queensland's first confirmed coronavirus case. The pair was part of a 9-person tour group from Wuhan, the epicentre of the coronavirus. They travelled from Wuhan to Melbourne via Singapore on January the 22nd and from Melbourne to the Gold Coast on January the 27th. They took a Tiger Airways flight TT566, landing on the Gold Coast just after 8 p.m. It's understood the man became unwell on the plane, then infecting the woman. They both stayed overnight at a Broadbeach hotel, and that entire tour group have since been taken to the Gold Coast University Hospital in isolation. 4 are considered well, 3 considered unwell, and young children are believed to be a part of that unwell group. Now, this brings the nationwide total to 9 when you count the extra Victorian case that's also been confirmed. Some health professionals say that Australia shouldn't be as concerned as some poorer countries.
The most positive thing so far, and it's very early days on the data, is that most of the exported cases from China have been relatively mild, and even 2 of the 9 cases in Australia have already been discharged from hospital. But clearly there are up to 18% of cases that are severe, and in poorer countries, if you had a significant pandemic where they don't have the capacity for good respiratory support, it could have significant implications.
And the Australian government is still in the process of trying to medically evacuate up to 600 Australians still stranded in Wuhan to Christmas Island, but some say this might not be the safest option for these hundreds of people.
Given the past history of Christmas Island, given its lack of proximity to emergency facilities, given the need to put in AUSMAT teams to back up the supply of medical professionals and medical technology on the island. We really didn't. We could have looked at much more appropriate and much more closer solutions to mainland Australia to assist in the repatriation and then the reintegration back into the community of these evacuees.
Now in Queensland, health authorities have been given extraordinary new powers that enable them to forcibly detain and treat anyone suspected of having coronavirus. Anyone that doesn't comply could face fines or even jail time.
Julia Bradley, thank you. We've had reaction, of course, from that announcement from WHO that this is now a global emergency from the Prime Minister Scott Morrison, seeking to reassure Australians about the steps that have been taken in Australia so far.
They have advised that it is expected that further international exportation of cases may appear in any country, and thus all countries should be prepared for containment, including active surveillance, early detection, isolation and case management, contact tracing and prevention of onward spread of the infection, and to full share data with the WHO. What I can tell you is that Australia has been acting in advance of this decision. Australia has been acting and our states have been acting with an abundance of caution.
An abundance of caution. So what has been the reaction from Australian authorities so far as this crisis has played out? On January 20, we had China saying they had the first case of a human-to-human transmission. This is important, initially going from animal to human. Once it's passing from human to human, that's obviously when there's a greater risk of this spreading out in society. January 23, Wuhan placed in lockdown, and yet January 24, still a direct flight from Wuhan to Sydney, which raised some eyebrows. On January 26, this was the report out of China that there were fears that the disease, the virus, could be passed on while people were still in incubation. That is, when they had no symptoms, they could pass it on to other people. The concern there being we have no way of knowing if someone was exposed to the virus other than simply if you backdate and figure out every single person they've been in touch with over the past 2 weeks. So keep that in mind from January 26. That was the warning coming out of China. On January 28, 2 days later, from Brendan Murphy, the Chief Medical Officer, there is no human-to-human transmission of this virus. It's important to note because we had some media about masks today. I know there's been a bit of story in the media about potentially some people being slightly infectious before their symptoms. So this goes as well to being able to pass this on when you don't have symptoms. But all of the previous experience with these coronaviruses, remember, they include things such as SARS and MERS, is that people are only infectious when they're symptomatic. So first of all, categorical on human-to-human transmission, and then pretty strong on the other aspect, passing this on when you don't have symptoms. January 28, 2 days after that China report. Then the next response from the Chief Medical Officer. A day later, the committee is aware of very recent cases of coronavirus who are at the time of diagnosis asymptomatic or minimally symptomatic. We're also aware of one fairly convincing case of probable transmission from a pre-symptomatic case to other people 2 days prior to the onset of symptoms. In other words, just a day later, contradicting what he'd been fairly confident about around how this whole virus is in fact passed on. Does it mean Australia has a reason to panic? Well, no, Australia is still very well prepared compared to most countries. We're a wealthy country. We have the ability to put people in isolation quite effectively. We have a stockpile of 12 million masks that are now going out to doctors. And of course, this solution on Christmas Island. But it does raise questions that if this virus does spread right throughout the country, if the worst does happen, and we look back at this particular window of the virus coming into the country, you'd have to ask questions about just how swift or just how cautious we were at times.